pregnancy is basically the pregnancy in females who are under the age of 20. Physiologically speaking, females should bear a child during her mid-20s for a healthier and safer pregnancy. Unfortunately, there has been an increasing number of teenagers who are having children at an alarmingly young age every year. Common reasons into why teenage pregnancies are continuously rising includes the lack of comprehensive education about sexuality, the lack of access to contraceptive services, peer pressure, and even the societal expectations on women's identity. Moreover, teenage pregnancy is associated with the risk of health problems for both mother and the baby.
Approximately 90% of births to girls aged 15 to 19 in developing countries occur within early marriage, where there is often an imbalance of power, no access to contraception, and pressure on girls to prove their fertility. Teenage pregnancy affects 5.99% of Filipino girls, which is the second highest rate in Southeast Asia based on Save the Children's Global Childhood Report on 2019. An estimated 538 babies are born to Filipino teenage mothers every single day. According to Philippine Statistical Authority, 5.6 million abortions occur each year among girls aged 15 to 19 years. 3.9 million are unsafe, contributing to maternal mortality, morbidity, lasting health problems, and even death.
Pregnant teens are at risk of not getting the right prenatal care, especially if they don't have support from their parents. Prenatal care is critical, especially in the first months of pregnancy. Prenatal care looks for medical problems in both mother and baby. It monitors the baby's growth and deals quickly with any complications that may arise. Pregnant teens may be at a higher risk of postpartum depression. According to a research study, girls ranging from 15 to 19 years of age experience postpartum depression at a rate that was twice as high as women aged 25 and older. Another study reported that teen mothers face significant levels of stress that can then lead to increased mental health concerns. In addition to higher rates of postpartum depression, teenage mothers have higher rates of depression. Depression can interfere with taking good care of a newborn and with healthy teenage development. Pregnant women aged 14 to 17 years are at a higher risk of preterm birth and of having a child with low birth weight. The earlier a baby is born, the more risk there is of respiratory, digestive, vision, cognitive, and other problems. Premature babies are more likely to weigh less than they should. In part, that's because they've had less time in the womb to grow. A low birth weight baby may need to be put on a ventilator in a hospital's neonatal care unit for help with breathing after birth.
Having the information provided, it is then important to educate women, especially the teenagers, about the risk of pregnancy. Spread awareness and knowledge about its risks and also the ways on how to prevent early pregnancy.
Teenage pregnancy prevention. The surest way to avoid pregnancy is not to have sex, or if you do have sex, to always use contraception. If you use birth control pills, condoms, or other forms of contraception, learn how to use them right and follow instructions. Talk to your parents or trusted adults about how to get birth control if you're sexually active. Ask your doctor, your public health center, or a Planned Parenthood clinic for guidance and prescription for birth control. Normalize starting conversations about sex and sexuality to children before their teen years. It is crucial for them to cultivate a positive attitude towards sex and learn responsible sexual conduct. Lastly, provide truthful details at all times.